Sweta.
Good evening, sir.
Yeah, we're now live. Dr. Sridhar, you can proceed.
So, thank you, Sri Krishna. A warm welcome to all the dignitaries. Dr. Shefali Gulati, who is the president of AOPN, and Secretary Dr. Prashant Kutage, and our AAPTCB President Dr. Garlapat Lakshman sir, Sunkoj Bhaskar sir, past president, and President-elect Sugunaka Reddy Garu, and Garlapat Shweta, Child Development Specialist, and our treasurer, Dr. R.S.V. Sri Krishna. Welcome you all, and all the delegates are already, I think they had surfaced into the YouTube. So this is the honor where this Autism Day, World Autism Day was celebrated. So for that, we had, because all the programs are on the same day, so we thought we can organize a beautiful program on the clarifications and doubts on the autism, frequently asked questions on autism on today. So today morning, we had a nice program Dr. Prashant had arranged in his Umang Foundation and Utage Clinic in Narayanaguda. It went very well. We had 70 parents and 35 children of development delay. Children came to the hospital, and we celebrated very well with the cake cutting and counseling them. And now I welcome all the dignitaries, and I request our Garlapat Lakshman sir to say a few words.
Yeah, thank you, Dr. Sridhar. And good evening and welcome all the delegates and panelists. And a very happy Hanuman Jayanti today. And I thank Dr. Sridhar and Dr. Prashant Kutage for conducting a wonderful program today morning at Mohan Foundation. Almost 70 members, 70 students have been attended. And thank you, both of you. And I welcome Dr. Shefali, Dr. Prashant Kutage, Dr. Garlapat Sweta, and of course my secretary, my treasurer, TCB treasurer, Dr. R.S.V. Krishna. All these are vibrant panelists, and we have a wonderful. We are going to have a wonderful webinar on autism, which is a very broad spectrum neurodevelopmental disorder. And of late, post-COVID, we are seeing a lot of cases. Almost every practicing pediatrician is seeing around 5 to 6 cases, new cases picking up in a month, of course. And some of you also picking more cases. And we need to sensitize the practicing pediatricians. And also we need to answer the questions from the parents of the affected children. And regarding these things, Pediatric Academy and also Academy of Pediatric Neurology both have together conducting this webinar. And we need to know a lot of questions to be cleared from all our panelists, expert panelists, and directly we go to the webinar. And before that, I acknowledge all the presidents, past president, president-elect, all the senior members in the group. And thank Dr. Shefali particularly. She's accepted our invitation to join this webinar. I thank you one and all, and I welcome and I hand over to Dr. R.S.V. To conduct.
Sir, I request Shefali Gulati, President AOPN and Chief Child Neurology Division AIMS, to say a few words. Madam, please.
Yeah, good evening, everyone. I thank all the organizers for having me over. On behalf of Association of Child Neurology India, I am Very happy to be part of it because autism spectrum disorder is a very important neurodevelopment disorder and the prevalence of which is rising. And it is not only because of increased awareness, the prevalence is definitely on the rise with the current CDC estimates being 1 in 36 this year on March 24, 2023. And last year was 1 in 44. As regards the Indian data, we had what we had collected for the Inclin study in 2011. That was 1 in 89. So that was 2011. And we know that with the increased screen time, there has been an association in last year's paper that there is an increased prevalence of autism spectrum disorder at 3 years of age of a child who was exposed to screen time at 1 year. So whether this COVID times where we are seeing post-COVID times, whether we are seeing this has some screen time got to associated with, but in any case, we have to understand that still autism spectrum disorder is an enigma, and there are a lot of some genetic factors, environmental factors, and epigenetic factors in which the environment is modifying the gene expression. And I think there is where what we can actually act on with possible therapeutic targets, with parental stressors and lifestyles, and being addressed, air pollution, pesticides, and so many other things. But now with this this year's theme is transforming the narrative, contributions at home, at work, in the arts, and in policy making. That means we have to take all of them together, and we have to remember that all 5 fingers are not the same, they are different.
Yeah.
So we have to take all, and there is the word is neurodiversity, and you have to transform towards a neuro-inclusive world for all. And when autism did not stop Einstein, Newton, Mozart, or Temple Grandin, neither will it stop my child, is what the parent should understand. And we have to work. And when we feel that the parents feel that there is no nothing to be looking forward to, but the hope is always there, and hope whispers the parents to try it all time. Yes. And only one more thing is there, a medical condition becomes a disability because of your environment. Yeah. They don't have physical issues in these children, your physical environment and the attitude of the people around you. So it is very important to empower everybody in the world, yes, globally, that the attitude is okay, so that this condition, which is neurodevelopment disorder, doesn't become a disability. Thank you.
Thank you, madam. I request Secretary Prashant Utage, AOPN, to say a few words.
Thank you, Sridhar sir, and thank you our past president Bhaskar sir, Lakshman sir, present president, and Sugunaka Reddy sir, and thanks Sridhar sir for sparing such a lovely time, because it was the great interaction with the parent. I never thought this is the combination of pediatric and pediatric neuro. Almost all 100 people were there in the morning, and quite good interactive session from Academy of Pediatric Neurology and Association of Pediatric Neurology. We welcome all on this good event, and thanks Shefali ma'am for accepting within short period of time for this invitation.
Thank you. Sir, I request Bhaskar sir, Sunkoj Bhaskar sir, President 2022, to say a few words.
At the outset, I sincerely thank IAP Twin Cities branch for taking up this very important aspect of our pediatric issues, autism. Not only IAPTCB, even Telangana State IAP is actively participating in this. And my special thanks to Dr. Shefali Gulati. Her inaugural remarks are like an abstract of the entire webinar. And I wish all the participants to have a great learning experience and great knowledge sharing experience. Thank you one and all.
Thank you, sir. I request Dr. Sugunaka Reddy garu. I think he will rejoin, I think. Dr. Garlapati Shweta, please say a few words before starting the webinar.
Yes. We don't take this as a disability, because the child will definitely improve. It's not like most of the times it happens like the parents do see it as, will it autism cure? Like no autism to no autism. Is it always like no autism to no autism? It may not be possible always, but the end of all the therapies and all, we target that the child becomes as independent as possible. That is a way forward in autism. We can't say that the child will be exactly like a sibling, or the child will be like any other typical development child. But the whole thought is that the child should be as independent as possible. That is what we are doing autism cure.
Good message, madam. Thank you. I request Pavan Kumar. Pavan.
Sir,
Pavan,
thank you, sir. Thank you.
Yeah, to say a few words.
Yeah, welcome all the participants for this much learned, much awaited session from IAPTCB. I think we are eagerly waiting for this webinar. It's like a revolutionary. It has come up, like, all the cases have. It's like an epidemic. We can call it as an epidemic. We are seeing so many cases, and parents are really shattered. I think the emotional attachment, psychological impact which parents are undergoing once we are suspecting, even when we are suspecting that the parents are undergoing a lot of turmoil and all. So for that, I think every pediatrician must be empowered with the right knowledge and right attitude, and how to counsel, how to break the news, and how to properly assess. And this is very important aspects, having that compassionate ear for the parents, which is also very important. I think this webinar will also address that human perspective, how to deal with parents when we are breaking that, when we are suspecting that and all. So I wish all happy learning for all the pediatricians attending this webinar.
Yeah.
Thank you.
Thank you, Pavan. Now I hand over to today's moderator, Dr. Sri Krishna RSV. And RSV, a small request, if Sugunakar Reddy sir comes, please allow him to speak few words. Okay, thank you. You can take over. Sure, Sugunakar Reddy garu, please. You can, Sri Krishna, you can start.
I think he has just joined. I'll just take a minute. Sugunakar sir, if you're around, just a few words before we begin.
Hello, good evening, Sri Krishna.
Yeah, please go ahead, sir, for your remarks.
Welcome to the webinar. Today, an auspicious day of Sri Hanuman Jayanti. In spite of all the busyness, Prashant and Sridhar have conducted a nice program in the afternoon. So we welcome the President Dr. Shefali and Secretary Dr. Prashant of the AOPN for this webinar. And welcome all the delegates of faculty. Please go ahead.
Thank you, sir. Thank you. Okay. Sri Krishna, you can.
Thank you. Thank you, everyone. And yes, namaskaram, everyone. And thank you, Indian Academy of Pediatrics and Twin Cities branch and AOPN Telangana State for coming together to celebrate World Autism Day. This is observed every year to raise awareness on autism. And this particular webinar is meant for all the pediatricians and also for the parents who have a lot of doubts in their minds. We often hear parents coming to the clinic saying this child has a slight speech delay. He's stuck to the TV or to the mobiles. He doesn't respond when I call him. He has repetitive behaviors. I heard about autism in my cousin. Does he have autism? And amidst all this, the parent is looking at you for a diagnosis, for you to say either a yes or a no. And trust me, it's a very difficult call. And I'll tell you why it is difficult, because as of now, it is a very dreaded 6-letter word. And once you say it, the parents are scared. Even the pediatrician at some corner of his mind is always doubtful whether we are dealing with an autistic child or not. And we'll know more about it and the recent developments and how technology is helping us and a lot more. And my sincere thanks to Dr. Prashant for putting this webinar together. And these questions, I'm sure, will be helpful to all the pediatricians who face the parents on a daily basis. A warm welcome to Dr. Shefali, the president of AOPN and the head of the Department of Child Neurology at AIMS. Welcome, ma'am, and warm regards on behalf of IAP Twin Cities branch. We look up to you and thank you for all the excellent work which you carry on behalf of AOPN and also at AIMS. So let me begin the panel discussion with the first question to Dr. Shefali. And let me, on behalf of all the pediatricians of Hyderabad, ask you the question which we all face in our clinics. A mother or a parent who comes with a child with repetitive behaviors, a child who's very hyperactive, keeps jumping all over the clinic, or who doesn't want to make eye contact with us, and asks us this question. And most of the parents in Hyderabad are well informed, and they often have this doubt, is this child autistic? And when we have to answer this question, one of the things pops up in our mind is, what are the early signs of autism? Second part of the question, how do you differentiate autism from hyperactive disorders or specific disorders of speech or communication? Is there anything very distinct, or is it still a gray area? what are the earliest signs of autism and how do we go about it? Over to you, ma'am, please.
Yeah, thank you. That is thank you very much for the warm welcome and having me over. For early identification, now they say that, you can also suspect in the first year of life. If the child whose hearing and vision is okay, even if you're not responding to name at 6 months of age, you may have. So they may have basically, they may have subtle disruptions in the social interest, attention, communication, temperament. And sometimes you may even be following up the head circumference. There may be an increased head circumference in the latter part of first year. But by the age of 2, generally we are able to pick up most of them. But and by the age of 3, the diagnosis is relatively stable. So basically what is happening is there is diminished social attention by 1 year and a poor eye contact with the vision remaining okay, and a lack of response when you're directing the speech to the infant. And there may be a decreased reaction to attempts to engage the infant into, any play or an interaction. They may, not be responding to their names, which may, be seeing by around 8 to 12 months. And they may not be babbling properly around 12 months. And the joint attention also, is problematic. And they may not be having the gesture production. So basically that is there. And they may have also, you may have increased object mouthing and unusual postures in the first life. And what happens is generally there are between the ages of 5 from the birth to 6 months, they may having some abnormal muscle tone, and they may have some more self-stimulatory behaviors, and they limited focusing on playing and toys, and they may have some hyper or hyporeactivity to sound, and maybe they sometimes like spinning objects a lot. And as I told you, around 7 to 9 months, you may have an increased head circumference. But, 1 in 5 of these children may not show any problem in the first year. So basically what we have done is we have had some screening tools which we have developed, socio-cultural sensitive. We have developed one to 18 months, from 0 to 18 months, a tool in which you have from 0 to 6 months, 6 to 12 months, and 12 to 18 months. We have 20, 21, and 21 questions as a screener to diagnose autism, with the sensitivity of picking it up at 1 year is around 90%. And by 1.5 years, it is, going up to late 90%. So we can suspect autism early. And for the pediatricians, I want you to know that this is the screeners. But, if you are having, 16 months, the child is not speaking one meaningful word, 24 months, 2 words with meaning, and you are having loss of any milestones, any language, whatever has come, or you're having avoidance of eye contact, preferring to be staying alone. Sometimes parents say the child is playing with others, but the child is playing alone in the presence of others. And whenever, there is echolalia, there's a repeating of what you're asking the child, or the child is spinning, or flapping or rocking of objects, or you have sometimes they like to smell inanimate objects. All these peculiar things, whenever they happen, then you have to have a strong suspicion. And for you, I want you to understand that we have developed an AIMS modified inclin tool based on DSM-5, which is very easy to be applied by pediatricians, development pediatricians, psychologists, and pediatric neurologists, of course. And it's available free of Google as well as Apple Play Store, with the Ped Neuro AIM Diagnostic, PED NEURO AIMS Diagnostics. And then you have, along with autism, you have ADHD, epilepsy, and neuromotor impairment tools as well. And it's from 1 to 14 years. And so you can put the age and get age sensitive questions. And based on that, you get what you have to ask and what you have to observe. And you are also given questions, examples, which are culture sensitive, what you want to ask. So it can be used by the pediatrician. Coming to the ADHD and ASD, I want you to know that they can coexist. We just now took out a data of 1,872 children with autism spectrum disorder, and 54% of them had ADHD. Actually, 80% of the 1,872 had some comorbidity, out of which 54% had ADHD. And one has to just see there's some features which are more peculiar to ASD, some are more peculiar to ADHD. Like you have deficits in social development, atypical reactivity to any sensory input, any stereotypic repetitive behaviors. Like I am moving my hand, but when I'm speaking, but if I'm not speaking and I'm still moving, so in that becomes abnormal. And you have fixed interests. They may like to put toys in a straight line, or maybe like to collect wrappers of any chocolates. They may like to have insisting on sameness. They may like to have fixed routines. They won't want to change the routines, or they they may like to have some spinning object like they are for autism. But for ADHD, sometimes they fail to give close attention to detail. They are making careless errors in schoolwork, and they have often difficulty in sustaining the attention to tasks. And, and they often lose things which are necessary for activity. So their forgetfulness and all go towards ADHD side, but, they often coexist.
Thank you. Thank you, ma'am. So you've actually given a lot of insight on what exactly is autism, what is probably not autism, what is coexisting with autism. Now that brings us to Dr. Prashant. And the first question, in case of even a doubt that the parent has, and the first question the parent asks is, what has caused this autism? Let me ask you a little more questions related to it. Is it the mother's fault? Is it the parent's fault of giving too much of screen? Was there autism 20, 30 years back? Is it something that is coming with more technology being used? And is this something that will increase in the times to come? All these questions put together to Dr. Prashant. And please also tell us if there is anything in genetics and anything that science is telling us with the advanced development that we have on the causes of autism now.
Yeah, so moving towards the causes of autism, usually everyone blames the mother when it comes, and they came to know post-pandemic, they says it's excessive use of mobile. If we utter the word, everyone look towards the mother. So it is not only the screen time, or it is not self-blame or the depression of the mother, but it's mainly the genetic factor which we considered initially. But post-pandemic era, everyone has witnessed there is rise in autism or speech delay or hyperactivity wave kind of thing. And the OP, even pediatrician is directly referring with writing ASD. Previously, they used to say suspected speech delay, but we are getting clear-cut reference. So it has so rampant now. So etiology mainly genetic, and when you see clinically on history and clinically that there is a clear-cut dysmorphism, there are few features indicative of Fragile X syndrome, then you can clear-cut say, okay, this is visible genetic cause. But there are many multifactorial where the epigenetics and the environmental factor plays major role. And nowadays with a nuclear family, less human interaction with the kids and the excessive use of gadget, that may be, and there are many papers now coming up on excessive use of gadget causing this problem. We can say new term that is acquired autism or virtual autism, it's coming up. So there are multifactorial reasons, but one of them is the genetic. And genetic, we cannot investigate every child or attribute to that. But there may be the like things like Fragile X, sometimes Down syndrome, or simple karyotyping may give the answer. But few times you need to take the help of chromosomal microarray, and sometimes whole exome sequencing may give the answer for this.
Yeah, thank you, Dr. Prashant. Now let me move on to Dr. Shweta. See, for any infection that we see, we usually have signs, symptoms. We have some diagnostic tests. There's some differential diagnosis, and then that's how we have learned traditionally pediatrics. Now, to diagnose autism, is there anything beyond just that checklist? Is there a radiological test, blood test, or anything that can objectively say that this is autism? Because a lot of it could be down to perception, and also the amount of time a clinician spends with the parent and the child together, and how subjectively that checklist is marked. So please tell us about diagnosis of autism, and at various ages, as Dr. Shefali explained, in a child less than 1 year to a child who's probably having poor scholastic performance. How do we diagnose autism before we start treatment? Over to you, Dr. Shweta.
With respect to the first question, that blood test or a radiological test, we actually don't have anything that is, yeah, this blood test, this is positive, so this is gonna be autism, or any MRI finding or any radiological evaluation where says this feature is there, this diagnostic, this is a feature seen on MRI, that's why this child is an autism. This is definitely a clinical and a symptom-based evaluation. There's no blood test or radiological test which proves and says this is autism. But having said that, we definitely do a blood test like thyroid function test. When the child is very hypoactive, the treatment has gone for 3 months, but the child is still not responding to the therapies. Yes, we do a thyroid function test. And with respect to the radiological evaluation, its MRI is done only when we see a neurocutaneous child with the neurocutaneous markers with autism spectrum disorder symptoms, or the child is hypotonic or seizure disorders or intense headache. Is the only circumstance where we do MRI as a routine part of our evaluation. And coming to the diagnosis, how do we diagnose a child? It depends upon the age of the child. Sometimes it's like 11 months, the child is coming. Mother says, when I go near, the child is not raising his arms to pick up, or the child is not giving, when I enter the room, the child is totally dumb. The child doesn't give an happy moment, happy expression that I have entered the room, or things like that. Then we don't have any checklist. We do with the symptoms, so that the child is excessively gazing off his hands, like the child is always not trying to explore things. The child is always fixed up, squinting his eye, seeing the spinning fans and all. Yes, then such circumstances, usually before 16 months, we usually go with the clinical symptoms and age-specific screening questionnaire, like something like an ages and stages questionnaire, which is age-specific, where it has many domains, like how is the motor performance, how is the expressive language, receptive language, and socialization and communication. But when the child has entered the 16 to 30 months, yes, the best, the most accepted screening is revised versions, where we still, after this also, we go with a diagnostic evaluation. But what is said is, if the screening questionnaire is more than 8, then we don't need a diagnostic. We don't waste the time in going around the diagnostic evaluation, because most of this diagnostic questionnaires, we have both observational and subjective. Like the most subjectives are what mother answers, observational is what a pediatrician or general development pediatrician is doing. Something like ADOS is totally an observational tool, but sometimes children will not cooperate, or the history-based tool, which is developed by which is an Indian scale. CARS, GUARDS are all most of the times history-based tools. So when you suddenly put this question in front of the mother is like confused, because most of them are 5-point Likert scale. Sometimes yes, sometimes no, or the mother may not be able to judge. This is sometimes present, mostly present, very rarely present. Most of them are the 5-point Likert tools. So sometimes still, even we do an MCHAT, we get a proper screening questionnaire, we may not end up doing a diagnostic evaluation. We directly put this child to intervention therapy. Or when a child is more than 3 years or more than 2.5 years, yes, most of the diagnostic tools definitely would help. Most commonly used are the CARS assessment tools. The current version is the CARS 3 or the ESA tool. Again, sometimes we have diagnostic glitches where we do the DSM-5 criteria. The child definitely has that A1, A2, A3, all positives, at least one feature of them. B1 to B4 criteria, at least the child is solving 2 of them. C and D is falling positive. But when we do a ESA scale, or when we do a CARS scale, the child numbers, the representative numbers are not specific of autism. So we still start off the intervention therapies, because the intervention therapies are all symptom specific or deficit specific. It's not like the child is severe autism, so this is the treatment protocol of the child. The child is mild autism, so this is the treatment. It's not like that. It's always deficit based. So diagnostic evaluation any tool can be used, the accepted tools, but in case when there is a diagnostic dilemma still, where the features are looking like features of ASD, definitely we go with the clinical decision itself and not with the scores of the diagnostic tools. So you muted yourself.
Yeah, sorry. Thank you, Dr. Shweta. So she pointed out the word deficit therapy, and that brings us to the management of autism. Dr. Prashant, as we understand, therapy is probably the cornerstone of management. What are the various types of therapy and how does it work? And before you answer this, just taking a question from the chat box, on the secular trend, as we have learned in SPM, is it that you're seeing more of autism because we are detecting it, or has it always been there and we didn't probably recognize it? Second, is there more reason being attributed to media and exposure of media to in the early ages to the children? Answer this and then go on to the question on therapy.
Yeah, so the answer to straight away, it is the awareness, definitely yes, attributing or contributing, but it is the mainly incidence and the prevalence has significantly increased. Now it is, as Dr. Shefali shared, 1 in 36. But in fact, if you see the metro cities, number might be more, 1 in 25. Those who are actually, even those who are practicing already developmental pediatrics or who runs the child development center, we are aware that I used to see hardly 2 to 3 cases in 2010 in a month. And now daily new cases of 8 to 10 cases, new cases along with existing cases. So definitely awareness is yes, but the prevalence has increased, and not media, but it is the digital world which is introducing to the kids early for the feeding. And at the same time, there is a less speech stimulation or different type of stimulation which child is lacking in a nuclear family because of the working pattern, especially the incident prevalence is more in a metro cities. And now moving towards your question on therapies, evidence-based therapies are ABA, applied behavior analysis therapies. Definitely there are many studies which shows that ABA has the evidence-based role, and they will have particular set of hours per week. And other therapies like occupational therapy, behavior therapy, sensory integration therapy, speech therapy. So these are the therapies. Now, as Dr. Shweta said, deficit-specific therapies we need to choose according to, it is a tailor-made. It is not like a blanket therapy that child comes and you start all therapy together. Because on day one, child may not be cooperative to all therapies. So we start with initially small session, small duration with the occupational therapy. As child come down with the little bit more attention, hyperactivity has come down, then we recommend if the child is cooperative and properly sitting tolerance has come, then we move towards the behavior and then speech therapy. There are different type of therapies. I'm now taking 1 minute on that. There are in the city, especially in Hyderabad, they go towards the Beamer therapy, okay, which is not evidence-based. It is just simple math. One of the center runs in Hyderabad. So please guide the patient that Beamer therapy, nothing has to do it. There is no evidence-based. So the proper therapies are like ABA therapy, occupational therapy, behavior, where sometimes they have the like educational issue, remedial education therapy may be useful. And there is a new hydrotherapy. There is a emerging evidence, but there is no clear-cut study showing the clear-cut benefit. Different are music therapies, but still there are lack in the clinical data or clinical evidence.
So, Dr. Prashant, let's say if you diagnose autism in a child, and let's say the child is typically around 18 months, so and has the typical symptoms of speech delay and also nil contact with people around, the typical autism cases that we see. So how long do you suggest therapy for them? See, for any medicine, you have a dosage, you have a duration, what time, what complications that come with it. How do you handle therapy then? Because this looks like an alien field for most of the practicing practitioners.
Yeah, excellent question. But nowadays we are coming up with an increased number of like developmental pediatrician and pediatric neurologist who has interest in a developmental disorder. So now what we follow is first we counsel the parent. First, change the environment, give the speech stimulation and the environmental modification at home itself. Therapy has to be done by the mother at the home. So home-based therapy. And if required, and if the child is not improving, then we say, okay, let us start the occupational therapy for 15 days to 1 month, see the changes. So we need to see the prognostication, how child is improving. For example, if it is a virtual or acquired kind of problem because of lack of stimulation, definitely this kid will improve over the period of 3 to 6 months. And then if it is a genetic, obviously it will take long time, but we cannot definitely say this much of time, but on an average 3 to 6 months definitely required. And we need to increase the counseling session for the parents. They cannot depend only on the therapy center. They have to do the home-based program also, so that there is a faster recovery for every therapy.
I'll just extend this on this to Prashant. I know because he's also managing these type of children at his center in Latur as well. Prashant, 60 to 70% of India is still in the rural areas. And we're talking about access to a developmental pediatrician, which is a very, very urban thing as of now. Now, how do you manage it in a village? And I'm sure you'll have a large number of children in villages who are probably autistic. So you start from diagnosis. And now that, let's say, you're able to diagnose, how do you now manage? Wherein even access to healthcare is probably deficient there.
See, what we have taken on a pilot basis, Latur is a district, but still we cater the most of the small villages. Till now, in last 1 year, we have seen around 4,700 cases screened, and out of that, around 2,800 child has been diagnosed. And what we do is we send our team every week, every day to the villages and teach them the home-based therapy. See, it is very difficult for the poor parent from the villages to come to the center daily. That's where from day one, let it be the metro city, let it be the village, let it be the district place. What is main important, best therapist is the mother. So we train the mother and it's working out. Last around 1 year, around 170 kids we have accommodated into the normal school, which have completely overgrown our outcome, has overgrown the autism. And there are around 70 kids who are inclusive education, means we are including them into the government Jilla Parishad school. And that's where our Umang Center is in a central, and on a right side, there is a Jilla Parishad school for boys, and on left side, there is Jilla Parishad school for the girls. So we could make that changes. And now we are launching a van that is Autism on Wheels, which will go every day to the small villages and train the mother. We'll show the video. And obviously, this has been discussed with our President Shefali ma'am also, where we get help from the our association too.
Thank you. Incredible work, Dr. Prashant. I'll come back to more management options, but let me quickly go to Dr. Shefali and ask her the next common question that parents ask once you start therapy for them. Dr. Shefali, I'm putting up two scenarios, one where you've diagnosed it in, let's say, the same 18-month-old child, one wherein you do the therapy. What is the prognosis when the child is, let's say, 12-year-old and then grows into an adult? The second is without therapy. What happens to this child at the same age of 12 years and also when the child becomes an adult?
See, nowadays the terminology in DSM-5 and ICD-11 is autism spectrum disorder. So that spectrum word is important, that everybody is not the same. Everybody does not have all the symptoms, all the challenges, and the severity is going to vary. So for me to answer your two questions will not have straight answers. It will depend on the severity, but somebody who you have picked up at 12 months or so obviously has manifested early and should be having symptoms from beginning, but does not necessarily mean that that person is going to be severe. It's just that they has been picked early, because you may go unmissed later on also. So basically, but if you could very rightly said that you have to incorporate all the intervention in a home-based manner and incorporate it in the daily routine, otherwise they don't serve well. It is thus that we have also seen on follow-up that the children who are given intervention early, their output is definite, their prognosis and their outcome is much better than those who are not given. And we had been giving that ABA along with structured teaching and sensory indication combined as a individualized. So they have shown definite improvements. They've compared those to those who have not been treated, and or if you compare their pre and post severity scores. So that means it is very clear that you have to give intervention. But other thing I want to tell you is the current autism spectrum disorder, you have the terminology has autism spectrum disorder with specifiers or not, that means comorbidities and your severity level. These children can later on go into remission, like a malignancy, that goes into remission. The things become passive, so the child can go into remission, and then at that point of time may not be fulfilling your DSM-5 criteria. That means the child has improved. So this happens definitely, and with intervention it will happen. And the point is, we have to see about it is a lifelong condition. It goes into remission, but the condition is remaining there. The issues have become passive, another situation coming, the another active issues will come up. The point is, the core symptoms, although the core difficulties and all, they do become less severe later on. There was a review in 2004 which had reviewed the autistic adults who were diagnosed with an IQ of more than 50 in UK, and they found that 12% of adults achieved a high level of independence. 10% had a social life and some employment. 19% were independent but living at home. But 46% needed specialist training and 12% needed high hospital care. So basically it is important, and I feel personally, and also the literature says, the child's cognitive situation, the DQ or the IQ, is the single most important prognostic factor. And I mean, obviously, as a condition will be there for final thing, and obviously the societal thing is important. And the repetitive and restrictive patterns are not much described in the adult literature, so they have not been seen, but the social communication impairments remain. So we have to pick up early. We have to start intervention. They are going to improve. Just remember that Mozart, Einstein, Marie Curie, Charles Newton, all of them are autism. Elon Musk has autism. So I think one has to understand that still one can challenge.
Thank you, ma'am. Thank you for giving those examples. In general, if I could ask you, what is the scope of majority of these autistic children when they become adult? And I specifically asked you the age of 40. Because that's a question the parents are concerned. What happens to the employment of the child?
After me. What happens after me? That is another thing. They want to understand what happens after me. So I told you something. Most important prognostic factor, which I feel after looking after them for last 26, 27 years, is their developmental quotient, the cognitive status. And in the West, the literature says 40% have cognitive impairment, but I have found up to 80% have cognitive impairment in our scenario. So most of these patients, are going to be dependent. So you will need to create their assisted living. Only a small subset, maybe about 20%, will be functioning well and having good job opportunities. That's why they are in the reservation. I am the chairperson of the subcommittee looking after their certification. So in that, it is there that we have reserved their category for all possible jobs, what they can do, but that will be a small subset. And we have to go on increasing, and mostly if we pick up early and we'll be trying to have an inclusive environment, we may be able to do much better. And the 20% would be going into those intellectual jobs, but we have to provide employment, like many of these hotels, the lemon tree chain are providing them in their, they are providing them jobs in which, in the room, the room service, not the room service, they are just, they are all those clean, they are just going around and not directly interacting with the people, but they are there in their sector, so in the jobs in the hotels and all, computer ones, they're doing really well. So that is we have to look at the positivities the parents see. We're trying to make them, what we try to do is we try to put them in mainstream. If it works, it's fine. Otherwise, do it open school, otherwise vocational training. Try to optimize and reach the maximum potential of an individual child so that he reaches the maximum potential and is going to become a respectable citizen of society. That is what our goal is. And that will depend on the cognitive level, how we can go.
Yeah. Thank you, Dr. Shefali. So we'll have to optimize so that the child, even the autistic child, can reach their true potential. Dr. Prashant, I have a small rapid fire on what is the relevance of all these. I'll quickly put it across to you and tell me in whatever evidence tells us. The first one is on diet. Diet tells us on very specific, for a child less than a year, for an adolescent, what is the role of diet in autism?
There is a definitely role if you prove that like a GFCF diet, which every center or every therapist gives like a blanket therapy, which is actually not correct. We need to see it is a tailor-made kind of thing where we need to identify the things which will make the child hyperactive. Like they blindly says sugar, wheat and milk don't give anything. And if you see the long list, they will enumerate so many vegetables, even fruits, that mother will get confused, and morning she will wake up with the anxiety what to give and what not to give. But evidence says you need to see the gluten sensitivity, do the tests, see for the lactose intolerance, and then only we should follow the things.
Next question, what is the role of steroids?
No role of steroid. There is no evidence as such.
Is there any oral medicine that the parent can give?
If there are comorbidities, yes, but if no comorbidities, no oral medicines.
Ayurvedic medicines?
Definitely no. Definitely no.
Any other alternative medicines?
No, because see here I want to as all pediatricians are there and they come across, because they come to me showing now, if you see online, there is some bread butter which consists of 3-DHA. They come to us and show us an ad whether we should use it. So there is no role. There is no evidence. These are the over-counter available gummies or which doesn't have the evidence. So they should not take alternative medicine or homeopathy or nothing.
There are some new molecules, glutamine and some new amino acids. And going back to the age-old DHA, what is the role of these?
There is no proven role, but there may be the things like if the child is deficient in a vitamin B12, vitamin D3, 3-DHA deficiency, they do improve with the supplement, but there is no clear-cut studies which shows the improvement.
Parents feel that if you put them into some science, some art-related activities, they outgrow autism. Is it true?
No, not kind of thing. So these are like.
So does music help in reducing autism features?
There are few studies, but there are no clinical proven studies regarding the music therapy. And as I said, Beamer therapy, it's now rampant in Hyderabad. Even ministers are supporting that center where she uses a mat. You have to lie down on that mat. It is a German technology, and it gives some blood flow to the brain, and child will improve.
So does it work? Does it work?
No, not at all. And many even bureaucrats are behind that now with that center, Beamer therapy, which is not indicated. So those specially practicing in a Gachibowli, please aware, if anyone comes and asks you Beamer therapy, straight away tell them that it's not going to work.
Thank you. Now I know what to answer. Dr. Mansoor asks on YouTube, role of sport.
Yes, definitely to come down on hyperactivity always in every child, and even child with autistic spectrum disorder and hyperactivity, there is a significant roles. And if you see ADHD, the Michael Phelps as won the gold medal, he was having ADHD.
All right. So that was a quick rapid fire, and thank you, Prashant. There are some more. I'll come back to that. But you've given a very dismal picture. For all the questions you said, there is no role. So that brings us the question to Dr. Shweta. Your parents at the end of it, when they get fatigued, tired and exhausted mentally, they ask you this question, Shweta. Is there a cure for autism? One. Second, if they want to go for a second child, what is the advice that we all as practitioners and the first contact pediatricians, what advice should we give?
Coming to the cure for autism, autism is not a disease. So there's no cure. We say cure a disease, treat a condition. Autism is a condition where there are development delays and development deviances. When you speak about the developmental delays, it is like the child has a speech delay, social communicative delay. The child has not spoken even a 2-word sentence, even at 4 years. That is a delay. When you say deviances, these children, when they're more towards children with higher cognitive abilities, the spectrum that we see most of in urban cities now is the mother will say at 2 years, my child is not calling mama, papa, but my child asks biscuit, open the door. And the child doesn't know how to call mama, papa, not able to speak 2-word sentences. The child will not tell, where is your eye? The child will not point this or point this. But the child is able to do pegboards very good. The child is able to recognize colors. The child is able to A to Z word sentences. I mean, A for apple, B for ball. The child is able to do it 2.5 years, but this child is not able to address the parents. That is the first. So that is a deviance. A typically growing child would do all this first and then shift towards the academics, that is the labeling the colors or something like that. But children with autism, they may have an inverse order where they do more of a rote learning is very good, but the child with emotions is very poor. That is a deviances. So there is no cure. All that thing that we do is a treat autism. That is a treat the symptoms of autism. So in the current stage, how we start with the treatment is we see where the child's baseline capacity is, that where is the child's speech age, that is the child is 2.5 years. and not even giving an eye contact or name call response. Absolutely not. We say the child is at 6 months of social age. And the child is able to point on his pampers or pants when he's wet. We say the child's ADL skills are at 18 months of age. So the treatment we give will depend upon the age-specific goals that the child has already attained, and from there we try to build up. It's not like the child is this age. 3 years, the child has come with autism. So we don't target the 3 years goal that the child has to do. We target with what is the child currently and what is the deficit that he is facing. And with respect to the time taking that the parents ask, it's not like every child will require equal. Sometimes child may end up going continuous with the therapy for 2 years and going the remedial education as it is. Yes. And along with
Dr. Shweta, the question was on next child.
Yeah.
Let's say the parent have the first child autistic, 2-year-old, now you diagnosed it and is on therapy. What's the advice for the next pregnancy?
With having one child with autism spectrum disorder, there is a 10% increased risk. The child, with the general population, it is a 3% risk. With the next child, the child will, for the second child, it would be 10% risk with a sibling with autism. When there are 2 siblings with autism, the risk is going to be 30%.
Thank you. Dr. Prashant, coming back to you, there are some more questions, very quick, rapid fire. Ratio of rural versus urban, Dr. Arjun wants to know.
Yeah, definitely.
In terms of incidence.
Yeah, so definitely incidence is prevalence is more in urban because of the working pattern of the nuclear family pattern, and there is lack of support from the grandparents. So obviously, but there is no clear-cut data on that. But practically, yes, more incidence in urban population.
Dr. Prashant, what happens in case of twins? Again, another question from Dr. Arjun. Is it that one of them gets affected, the other also gets it, or how does it normally work in twins and autism?
Twins, usually one child get the autism. There is a likely chance that second child getting autism is around 10%. And if the second child is affected, obviously it is more than that, 20%. And in twins, sir has particularly asked how many twins you have seen till now with one kid affected. So you can say approximately 3 to 4 twin babies, one baby is affected, but not second. It ultimately depends.
Next, very interesting question by Dr. Sunkoch Bhaskar. Child with ASD. Now, how will it affect the behavior of his normal sibling and vice versa?
Obviously, there is a study going on that what is the effect of the on complete family social behavior. It's definitely if the one child is having the autism spectrum disorder with behavior issue, definitely the younger one will pick up, and they may show a few signs of hyperactivity and sometimes speech delays.
Yeah. Dr. Subnakar has a couple of questions. Instance of epilepsy or seizures in autism, do we put them on any anti-epileptics as such?
If we screen them and if we find the EEG is grossly abnormal, definitely yes. With the broad spectrum anti-epileptic anti-seizure medication we started.
Broadly, what is the average IQ of autistic children?
It's not broadly. Means 30% are associated with mild or borderline intellectual impairment.
What is the role of pyridoxine?
If there is a pyridoxine deficiency, yes, but not in a blanket therapy for everyone. There is no.
Dr. Ram Bandaro asks, is there any medicine for these repetitive behaviors and echolalia that can occur in ASD?
Echolalia, no, but definitely this repetitive behaviors, if the child is irritable, agitable, then risperidone may have the role in that.
Right. Now I have last 2 questions. I'll go to the last question to Dr. Shefali. Very interesting question. Is there anything, any suggestions for parenting? Dr. Arjun asked that, is there any change in parenting that we need to adopt?
Yeah, whenever we start, I think we have to understand that even pediatricians, when we have to counsel the whole family. You are not just treating the child, you're treating the whole family. And it's a family-centric thing. And you have to give them coping strategies from the beginning. so that, otherwise we had done a study in which 70+% of mothers and end up being depressed. So we have to talk to them about it, having to tell them that, whatever you have to make effort, you have to explain the condition, and the child is going to improve. But when you work for 100% effort, the return you're going to be 30 to 40%, so that they understand their expectations are realistic. And we have to also tell them that it should not be that it should be left on one member of the family. It should be total family which has to be there. And otherwise it is there is nothing else different about that. But only thing is that we don't expect them to change. You have to change with them, and whatever you tell them by verbal cues, by if they give them a visual cues, they're better. So you just tell them to make a routine on a on a sheet of paper, and with the pictures for what the child is expected to do. And at the end of the day, have a column in which you're going to tell whether the child was good, you put a smiley. If it was not behaving good, then you put a sad face. And then on Sunday count what is more. If the smileys are more, you give them a positive reinforcement by giving them whatever the child needs. Slowly, the child is going to improve. And that is how we have to move forward. That is what we have to tell the parents.
Dr. Prashant, one more rapid fire. ASD adults, can they marry?
It's a very difficult question, but yes, there are few things now coming up. In Hyderabad itself, there is one of the psychologists who runs the autism ashram, and they're trying that to get matched because parents stay nearby only. So yes, if it is the intellectual capacity is borderline or up to the mark, they can. But if it is intellectually severely impaired, definitely answer is no.
Thank you. Now the last question. Thank you everyone, Dr. Chandramouli, Dr. Ram, everyone who has shared your comments, suggestions and questions on YouTube chat. Thank you so much. Last question, Dr. Shefali, and this is my personal question and also posted by others. I've worked with UNICEF for a decade. I've been part of the state task force on establishment of DAIC. We are hearing from this webinar that the incidence of autism is increasing. 1 in 36 is a huge number. I mean, if you actually realize in a school, in a class of 40 people, one of them is autistic. That's a big, big number. Private sector cannot tackle this. There is no way in which we all as private practitioners can address this. A large number of people, many children are in the rural setting. Even in the current state, I stay at Gachibowli, but I know for sure a large number of Indian population is in district headquarters, is in villages. The major stakeholder is government. And I know as a professor and the head of the neurology division at AIIMS, there's a lot of work that you're doing. So 2 specific questions, ma'am. How do we tackle this in the years to come? And we need a very strong system. We are still struggling on establishing a strong neonatal care at the district level. The SNCUs have come up and we are looking at expanding it to the sub-district level, and somehow the NMR is slowly coming down. But then how do we tackle this? What is government's plan? Because in the private sector, even the cost becomes a factor. After 2-3 years of therapy, I'm not sure if everybody can really afford this therapy sessions in the private sector. So how can government, and I'm sure you're working for the government at AIIMS there, how can government really solve this? Secondly, how can AOPN, IAP Twin Cities branch, and in general, all the professional organization, how can we come together and solve this problem? The last question for the night to you, ma'am.
Yeah, thank you. Thank you so much. I think it is important to understand that we have to be clear about the evidence-based guidelines which should be available to our pediatrician friends and pediatric neurologists, so that we are optimizing the care which is there. With the Academy of Pediatric Neurology India, I'm the national guidelines coordinator, although I was the president in 2021. So we are making guidelines. We'll be coming out with guidelines with autism. And in that case, we'll be able to empower our pediatrician colleagues what it should be done. As Association of Child Neurology India current president, we are trying to have special interest groups being created with all kind of centers, so that we will be bringing the whatever the possibilities to train the pediatric neurologists as well as pediatricians who are working, developmental pediatricians. Other thing is that being with the government, also being chairperson of for the disabilities for the ministries and and many committees. What we have been trying to do is, first we got that the disability certification thing, which is now being streamlined and being revised, having their reservations in various jobs, but actually it's not trickling down well. So we are just empowering people to understand how to go and diagnose them early. Then we are developing, along with WHO, we are developing a package in which we are trying to replicate a model of a primary health center, secondary health center, and a tertiary care center, and trying to see the newborns, and like, from your SNCUs, the sicker and smaller newborns are coming out. So they are upcoming challenges of neurodevelopment. So we are trying to develop a platform in which we are having screening, diagnostic, and intervention packages based on videos linked, which will be available. We are making it with the WHO thing, which once it works, it will be available pan India, and we will be giving to the government if it works and it replicates. And like the tool was being mentioned, ASQ3 for screeners. So we have done a social culture adapted version. So all those, whatever India we have social culture adapted versions, we will be making it available, and then that one which can be coming, and the DICs and all, and of the Ministry of Health and the Disha centers of the Ministry of Social Justice, they are trying to have and trying to reach out to more. So once we get a platform which will make from screening to diagnosis to intervention packages which are AI based, I think that may also help. And that is how we have to move forward. And we have to see that what are the evidence-based things only we should go. Sometimes we should not go just by word of mouth. And for a pediatrician, you can't read everything. So I have one principle basically responsible, which I feel we have a pyramid. We have to go to the base of the pyramid, to the periphery, to empower all the pediatricians, giving evidence-based, which will be recurring guidelines. That's why I'm the guidelines coordinator for the AOPN, and I told that I'll keep doing that. And other thing is for Association of Child Neurology to increase the bar to go to whatever is available with the technology. And I think together we can make a lot of difference. And it has to be a close cooperation and coordination between the pediatricians and the pediatric neurologists and development pediatrician. Also, additionally, we also are working on empowering the parents. So we have made a lot of parent information material, and it is important for parents to understand what is evidence-based stuff to whoever can read, and those who cannot, we should have it regional languages, and then probably develop videos for that. We are developing that, and once we are developed by the end of this year, we can share for regional translations of the languages.
Thank you. Thank you. Prashant, please.
Yeah, just to add to this, we have created the army at Latur, where RBSK doctors, Anganwadi workers, government teachers, special teachers, we are training and making them aware, because they are the ground root worker who will detect it early and we can intervene early.
Thank you so much. I think that's the way forward. We can only treat a small subset. In fact, you look at all the pediatricians in the city, we're probably treating equivalent number as what, let's say, Nilofer and Gandhi Hospital are treating on a daily basis. A huge number of children are treated even now, even in Hyderabad in the government sector. You start going a little away from Hyderabad, a majority of them still go to government. So we need a very strong infrastructure, a strong plan of action to detect them early and also to treat them. And I'm very happy that AIMS is leading this movement in creating the guidelines and also taking this. Thank you, Dr. Shefali, Dr. Shweta, and Dr. Prashant. It's such a pleasure to ask you all these questions. It's been a very enlightening session personally for me. Yes, ma'am, please.
We forgot to mention stem cell.
Stem
cell has no
two questions.
benefit.
Two questions before I finish. One is on stem cell, role of stem cell therapy. And the second one, ma'am, very futuristic. What is the role of artificial intelligence? Anything that we're looking at chat GPT and AI currently, and it's all a reality right now. A few words from you on that, and then we can close this. Over to you, Dr. Shefali.
The stem cells as of now is there for the future, and we are also doing research on that. We are doing on mesenchymal stem cells. We are driving exosomes and working on ASD mice, but we have made guidelines, and along with NMC, it is very clear that in clinical practice, it is not to be used right now. It has to be encouraged in research so that we have definitive evidence. One, yes. The second thing is we have to also work for the AI, and all has come in big way in three things. They are using AI techniques to use the old tools what we have and pick up the small data points which are more informative, so that you have less number of questions to be asked and reduce the time to administer. Number two, they've coming with tools which are new, novel, like eye gaze and all that, the child's behavior. Like the FDA has approved one of the one of the softwares, and in that software you are having some questions you are asked, asking the parents, and a video which has to be done. Number 3 is the intervention part. In the intervention part, you're also working with IIT and many CDAC and IIIT and developing some robotic toys. And we have already developed prediction, joint attention skill, improving apps and all. They're working in research mode. Once they're available, they will be freely available on platform. So you have both screening, diagnostic and intervention, including also robotics and many, many things which are virtual reality, augmented reality, and they are actually a fact. But one thing, we should have some indigenous ones in India developed. Wherever it is developed, they can be used. And what we have been developing, we'll be making it freely used to everybody pan-India for sure.
Thank you. Thank you. Very promising times, despite all the no that Dr. Prashant and Dr. Shweta told me. All the questions I asked, they say no role, no role. But thankfully, Dr. Shefali says there is some role of technology.
No, but I'll tell you, but Shri Krishna, I'll tell you what, you know, the children are reacting more with robotic toys. They are either the parrot one, Kilikro, or you are the humanoid robot. But when they improve interaction with robots, whether they will improve the human to human interaction also, it is also not very clear. You understand?
Yeah, so
it is hopeful.
That's interesting. Yeah, hope is there. Interesting times. I'll now hand it over to Dr. Sridhar for inviting comments from other panel, other EB members here, and then propose a vote of thanks. Over to you, Sridhar. Thank you so much for the opportunity.
Sir, nice talk, sir. I request Dr. Arjun sir, Central EB member from Telangana, Central IAP EB member, to say a few words, sir, please.
Good evening, all of you, and good evening to the experts from starting from AIMS, Dr. Shefali and all others, our own experts, Dr. Sweta, Dr. Prashant, and all of them, Dr. Bhaskar, Dr. Lakshman, and our Sugunakar and others. It's a need of the hour to have repeated sessions on autism awareness and ASDI. As you know, the incidence is so much increasing, and so much so, we are at times we wonder, are we overdiagnosing? And our own fellow doctors keep saying that I'm sure you must be overdiagnosing. We keep rechecking and all that. But I don't think that's true. Definitely, it's on the rise. I'm sure Dr. Bhaskar will agree with me. 20 years back, we hardly used to diagnose the ASD cases, or it was only ADD, attention deficit disorder. And it's especially for the last decade only, we are able to clearly make out a diagnosis of ASD. Especially last at least 3 years, and sometimes you get scores of cases in a week or even a month. And I firmly believe the parenting has changed for the worse, not for the good. The technology, the education has changed the parenting for the worse. I still feel that's why I asked the incidence, rural and urban, what is the ratio of rural and urban? I'm sure our colleagues will agree how much of patients coming from the surrounding villages, from the cities as well as from towns, how much incidence is there, how much it is there in the urban areas, and also our own NRI friends and relatives, how many they are suffering. So I feel at least, studies have to take place on this. The parenting has to do with it a lot or not. I definitely feel, because now the focus is on that first 1,000 days of life where the brain maturation, everything is there. And that's why in the Lakshya program, we are focusing on early child ECD, the early childhood development, first 1,000 days, very crucial. So I'm sure maybe the results will come in the years to come. But meanwhile, more and more centers of autism, centers for developmental disorders should be there. Periodic sessions will be there. Sensitization of every pediatrician should be there. And also sensitization of even parental groups, grandparents particularly have to be there. Because you see, because of the migration, there's so many grandparents are taking care of the children who are left with them to take care. The parents are there in US or Middle East, but the grandparents here are looking after them. And they're so burdened, it's all new to them. They've forgotten their parenthood, parenting long ago, about, let us say, 40 years back or 30 years back. So it's not just the pediatricians, even we should look at even grandparents also. That's my opinion. Thank you for the opportunity to talk and give our inputs.
Thank you, sir. Thank you so much. Now I request Srikanth Manda to say a few words. Srikanth, are you there?
Yes, sir. Yes, sir. Thanks to the speakers, Shefali Madam and Prashant. So it's an enlightening one, educating one, and especially I want to appreciate Prashant for helping the rural children who are suffering with autism like disorder ASD with his initiative. So wonderful initiative, and so looking forward to participate in such good programs academically, helping enriching activities. Thank you, President.
Thank you, Srikanth. Shabir, our Vice President of IAPTCB, please. Shabir Ahmed, can you use?
Yeah, thank you. Thank you, Sridhar.
Yeah.
Thank you for giving me this opportunity. And I thank all the participants. Prashant sir, it's for the good day. I think inauguration by our secretary to your center is also a very good beginning. I think this autism has become a very, what you said, diagnosed and underdiagnosed disease or whatever you say. But what I see in our clinics nowadays is more of the parents, they don't want to accept the reality. That once you say that this could be autism spectrum disorder, if you tell that, the next day they won't come to us. So this is also a big challenging, educating the parents. I think the FAQs which Sri Krishna has taken has thrown a lot of light. Thank you, Sridhar. Thanks once again to all the panelists. Thank you once again. Thank you very much.
Sir, Sumkoj Bhaskar, sir, any comments? Final remarks?
Yeah, I have nothing to say, but really we had 3 experts. With their wisdom, we could know more and more about it. But one thing is sure, the prevalence is increasing. All the pediatricians, whether they are developmental pediatricians or not, they need to develop the knowledge and awareness about these problems, and they should be able to pick up soon and, if possible, treat them or refer them to the development centers. It was a very useful webinar. I congratulate both the bodies, IAPTCB and AOPN. Thank you.
Thank you, sir. Thank you. I request our Sri Krishna RSV to our treasurer of IAPTCB to say a vote of thanks.
Yeah, thank you everyone. On behalf of our Indian Academy of Pediatrics Twin Cities branch, thank our President, Dr. Lakshman Garlapati, past President, President-elect, Central IAP members, our Vice President, EB members of the state and also the Twin Cities branch. Thank you for actively participating in all the IAPTCB activities and making it a grand success. A big thanks to all the participants on the YouTube channel. I had to constantly keep looking at questions. Dr. Chandramouli, Dr. Ram, Dr. Mansoor, Dr. Ajay sir, all of you, thank you for actively participating, and I hope we could put in all the questions that you bombarded us with on the chat box. And thank you, big thanks to Dr. Shweta, Dr. Prashant for bearing with all the questions which came out of box. And I told you, the questions which I have are only tip of iceberg. You'll have a lot of questions, which are all the questions which we face as pediatricians. And these are questions that parents ask us. So you need to tell us what we have to tell them. And a huge thanks to Dr. Shefali ma'am. Thank you, ma'am. Working at AIMS and also as president of AOPN, you're doing remarkable work. And we look up to you, look up to the organization, and of course, AIMS as well, for guiding us in the times to come on how to manage autism. Our thanks also to the AOPN Telangana state team, Dr. Lokesh, Dr. Prashant, and the entire EB for joining hands with IAP Twin Cities branch. Thank you, everyone. We wish that we'll be able to take this message on raising awareness on autism forward, and it won't just stop with the celebrations on a day. Let us take it forward through the year, and let us try to raise awareness and also address these common issues which parents keep coming to us for. Thanks, everyone. We'll be sharing this link of the YouTube recorded session. Please share it with others. And I'm sure most of these questions are common queries in parents' minds as well. Thanks, everyone.
From my side, special thanks to RSV Sri Krishna, who made a beautiful, lively session with more interaction and these 5 questions and everything. So you made this autism awareness program a lively thing. So special thanks to RSV. Thank you. Thank you, one and all, sir.
Dr. Sridhar,
let me just
Dr. Sridhar, Dr. Sri Krishna, I wanted to say that next time I want to organize some panel discussions, I would request you to be the moderator. So I wanted to say that, even if it's so that is why I'll take your contact with Prashant.
Yeah, me and Prashant have ongoing enmity towards each other. So whenever I want to trouble him, I put him in such spot. And
I'll get you both. No, I'll get you both there. So I will be requesting you to join and moderate panel discussion. I'm sorry I interfered in between, but I wanted to say that because it is really nice. I really
thank